Initial assessment. The goal is to understand the nature of the grief and determine if it's normal or traumatic. The therapist gathers detailed information about the loss experienced. The context of the loss and the associated emotions are explored. We investigate if the patient shows symptoms of complicated grief. Preparation for therapy. The goal is to prepare the patient, build trust, and explain the EMI method. The therapist reassures the patient about the safety of the method. Specific therapy goals are defined. Execution of the EMI technique. The goal is to facilitate the processing of the painful memory through eye movements. The patient is invited to remember the traumatic event. The therapist guides the patient through specific eye movements. Monitoring reactions and feedback. Evaluate the patient's reaction and adapt the technique if necessary. The therapist carefully monitors reactions and asks for feedback. If the patient shows discomfort, the therapist can slow down or stop the session. Integration and session closure. Facilitate the integration of emotions and memories. The therapist invites the patient to reflect and share changes. The positive changes achieved are consolidated. Follow-up and progress check. Evaluate the effectiveness of the therapy and plan the next steps. Changes in symptoms and overall well-being.